I would like to thank the organizer for inviting me to speak about drug-drug interaction with cabotegravir and rilpivirine. These are my disclosure. So I'll start first with some pharmacokinetic properties. Cabotegravir is mainly metabolized by UGT1A1 and has no inhibitory or inducing effect on drug metabolizing enzyme or drug transporters, with the exception of some inhibitory effect on OETs. Rilpivirine is mainly metabolized by CYP3A4 and has mostly no inhibitory or inducing effect, so that both cabotegravir and rilpivirine have a low potential to cause drug-drug interaction. However, this agent can be victim of drug-drug interaction. Now, some interaction can be avoided with the intramuscular administration of this agent, and those are for cabotegravir, interaction with divalent cations, and for rilpivirine, interaction with drugs that can increase the gastric pH. You can see here example of drugs that interact with the oral but not the intramuscular administration of this agent. Of course, drug-drug interaction can still occur at the hepatic level with the intramuscular administration of these drugs. This is illustrated here with rifampicin, which will cause a substantial reduction in cabotegravir exposure. Now you can see that the magnitude of the interaction after oral and intramuscular administration is very similar, which suggests that bypassing the gastrointestinal tract might not mitigate the magnitude of drug-drug interaction. Now, drug-drug interaction studies have been conducted essentially with the oral administration of cabotegravir and rilpivirine, and you can see here drug-drug interaction studies that looked at the effect of cabotegravir on comedication as well as the effect of comedication on cabotegravir. Cabotegravir has a low potential to cause drug-drug interaction. However, cabotegravir can be impacted by strong inducer, as we have seen, whereas moderate inducers, such as, for instance, rifabutin, have a modest effect on cabotegravir exposure. Rilpivirine has also a low potential to cause pharmacokinetic drug-drug interaction. However, rilpivirine can be substantially impacted by a strong or moderate inducer, so that their co-administration is contraindicated. Now you have to know that interaction with moderate inducer can be overcome with the oral form by doubling rilpivirine dosage to 50 mg once daily. Now, if we look at the drug-drug interaction profile of oral and long-acting cabotegravir and rilpivirine, when considering more than 700 co-medication, you can see that rilpivirine has a higher potential for drug-drug interaction compared to cabotegravir, which can be explained by differences in their metabolic pathway, also due to the fact that rilpivirine at supratherapeutic dose has the potential to prolong the QT interval. So to conclude, there are still several unresolved questions related to the management of drug-drug interaction with long-acting cabotegravir and rilpivirine, and which are, for instance, whether drug-drug interaction with moderate inducer can be overcome by giving an extra dose of oral rilpivirine, or how to switch from an efavirenz or etravirine-containing regimen to cabotegravir plus rilpivirine. What is the relevance of certain drug-drug interaction in special population, or how do we manage drug-drug interaction in case of missed injection visit, or what is the effect of variation in the injection site or injection method? So I'll stop here and leave some of these points for discussion. Thank you very much for your attention.